Childhood obesity is since becoming a global pandemic, leading to a decrease in health of the population. This affects the healthcare system and government by placing increased financial demand on the public healthcare system. The purpose of this presentation is to give you an introduction into childhood obesity, the increased costs that the public healthcare system is absorbing, and childhood obesity and how it onsets into adulthood and disease states. Now, childhood obesity in a linear progression. In 2009, 6.8% of Australian school children were affected by obesity. In 2014 to 2015, 27.5% of Australian school children were affected by obesity. And 2015 research predicted that Australia is going to outrank the USA and UK in obesity levels. Now, in 2018, Australian Bureau of Statistics reported that 67% of adults were overweight or obese, and that was an increase of 4% from 2015, which establishes to about 12.5 million people. 25% of Australian children were overweight or obese between the ages of 5 and 17. That actually was a decline of 2.5% from 2015. So the interventions that I'm going to present to you in this presentation have been proven to work. So we're looking at evaluating and establishing future funding and future interventions to help this curb this cost and promote healthcare in the next generation. The problem in healthcare costs, the Australian government absorbed $43 million in 2015 of healthcare costs just in the obesity sector alone of children between the ages of 6 to 13 years. Now, in 2018, the annual cost to Australia was estimated at $64 million. And the reason that being is, you can see here taken from the Heart Foundation, is the vicious cycle of childhood obesity. We have a healthy child, we have all study, no action, video games, high-fat foods, turns into mild childhood obesity, increased inhibition of movements and exercise may be caused by lethargy, turns into moderately obese child, exercise becomes uncomfortable and painful and emotionally damaging as well. Severely obese children converts into asthma, diabetes, musculoskeletal issues and diseases, prevents exercise and diminishes exercise and may bring on depression and low self-esteem. Now, why? Well, obese children are more likely to remain obese into adulthood and more likely to develop health consequences such as diabetes, cardiovascular disease, physiological, and also sociological challenges. With the increased risks of health, including sleep apnea, bone and joint problems, asthma, type 2 diabetes, and psychological problems as well. All these place costs on the public healthcare system and also influence activity levels and also emotional standpoints in the community. Now, the target population for this project plan, well, it simply cannot be targeted to one individual sector. Now, one specific target simply cannot be met due to the neurological development of the human brain. So multi-level planning and a sociological-based proposal for multi-levels of education from preschool, primary school, high school, and adulthood. Community education programs, the aim is to help participants identify health-associated risks that arise from poor knowledge and understanding of nutritional intake, exercise management plans, and the effects of obesity on mental health, wellness, in a sociological standpoint relative to the community, school environments, and the family impact. Now, a systematic review published in 2012, school-based interventions to reduce the BMI between 1991 and 2010 found that the implementation of school-based programs that contain physical activity and educational programs reduced the body mass index of children. That would probably be relative to the actual decrease of percentage of 2.5% from 2005 because of the implementation of these programs. Now, implementing a plan and program that works is solid to the justification of research. Also, contribution from both private and public school sectors is how the problem of increased healthcare costs may be diminished, as well as a health and increased quality of life of future generations can be curbed in a better direction. The education of parents and teachers about these particular programs in schools to help navigate, also aid in support from parents and social sections, needs to be implemented in a more passionate fashion. Applying school education is one part of the battle, but as research suggests, having parents more understanding of their own BMI radically affects the success and outcome. The goal is to curb public healthcare costs by reducing the onset of childhood obesity. This means schools have an obligation, families have an obligation, parents have an obligation, and a duty to help tackle and improve obesity before the problems take into adulthood. Now, justification. A complementary project plan. Let's introduce you to the IVAC method. Investigation, vision, action, and change. Now, 2019 research conducted equaled to a positive outcome. Now, in 2006 to 2018, a random controls trial was published in the Journal of Clinical Nutrition. Interventions using the IVAC methodology did contribute to a lower incidence of increased BMI in primary school children. The intervention was effective to influence both child's and parents' behaviour. This method could be applied in both the private and public schools across Australia to help curb problems. Now, what is the IVAC method? Investigation, vision, action, and change. This is a multifaceted level between integration between parents, children, and schools to promote knowledge, health, and understanding so application can be applied. This method involved parents and children to be a part of an active change. Parents were asked to record their weight, height, educational levels by questionnaires. Children's weight, height, physical activity was also assessed in 2006, 2008, 2010, 2012, and 2016, assessing BMI over a linear progression relative to healthy changes. Now, what they found was using the IVAC method, investigation, vision, action, and change, what they found is that the child's BMIs increased by 1.26 compared to 5.2 if the father was obese. So what they found that if the father was obese, they had a 1.2 kilogram per meter square increase in BMI relative to if the father wasn't. If the mother was obese, the increase was 2.37 kilograms per meter squared. This was not associated to the parents' education level. So what this is saying is basically the influence of the parents dictated a positive or a negative outcome in the child's BMI, indicating despite education levels of the parents, it was the parents' particular influence and current BMI status that altered the results in a negative way for their children, indicating the ability for parents to maintain a healthy weight and BMI impacted the health and increased BMI of their children. Now, the intervention, a systematic review published in 2010, introduced that the implementation of school-based programs work. Children that are obese from 5 years old are more likely to remain obese later in life, establishing that once a set point of weight was obtained, is more difficult to reverse. So implementation of programs must be implemented early. Establishing education. So the simple way is educating people about the Mediterranean diet. The research indicates education about the Mediterranean diet and adherence to this nutritional intervention has been shown to be the best at reducing heart risks and of being obese. It's a very simple plan to follow, but education is key of letting parents know what is healthy, how to maintain this, and how to implement this plan. The goal is to improve awareness and knowledge of the Mediterranean diet and nutritional strategies, and they've been proven to help prevent obesity and reducing BMI. Apply these interventions to new parents or parents with young infants or prepubescent children. Apply the IVAC method into schools to get parents and children's participation between the ages of 7 and 14 years of age. Thank you very much.